We're here for 1 hour. Slow and easy. Getting set up here. It's a beautiful Sunday. We had a little bit of snow in upstate New York, very light and easy. And again, welcome to all. Here to share some thoughts and ideas on how to improve your fertility, your health and wellness. Damara, number one, thank you. Always appreciative to all those joining us and spending the hour sharing around, all the likes and loves. We like and love everyone out there, and grateful to be able to share today and every day. And if you're not able to watch this live, just sign in at any time and share it around. Just getting going here. And again, questions, thoughts, ideas, local, national, global, seeing patients from around the world. At See My Fertility, it really is about integrative, holistic, affordability, and quality. And the access is for everyone. And here to turn no one away, doesn't matter. Remember, we're healthcare practitioners to help people find that health and wellness naturally as best as possible. But if it's not happening naturally, what integrative and new approaches can we add to the puzzle here to help make it work? Again, Monica, Christina, Chelsea, just fantastic. So grateful to everyone for joining in and sharing. Remember, share with a friend, a family member, share it on whatever support group you're on. That Seeing My Fertility is here to help and share ideas. Fertile Fireside Chats, 8 p.m. Sunday Eastern Time every week. And again, from Shauna from Ohio, Alexandra, hello, Kristen, happy Sunday. And again, we're here to answer your questions. Talking a little bit about ERA now is okay and legal in New York. Hallelujah. We don't have to find a place around the country or another country that'll help do your endometrial receptivity assay. So at our Albany, Syracuse, Rochester, Buffalo, we're here to help synchronize the endometrium to the embryos, so the proper timing for transplantation or embryo transfer. Monica, how you doing? Let's see. Christina, I think I've already said hi. And we're here to share some thoughts and ideas that you bring to us and we can bring back to you. And so thank you, thank you, thank you. We got the fire on tonight, low and easy. Again, as I said, we had a little bit of snow in upstate New York. We're used to it. And the flights and travel carries on throughout the winter, by the way. We're nonstop. Hello, Elizabeth from Oklahoma. Yulia from Atlanta. Dr. Vera Dallas and Vera Dallas in Atlanta. Welcome to the team there. The global team is going to be helping. I'm also going to be helping getting things rolling and moving forward, seeing clients already, but lots of support coming from the mothership in Syracuse. But I'm also want to give a really great shout out for the Albany team, Dr. Ditkoff, Dr. Grossman, seeing patients from around New York, around the country and around the globe, and really easy for our patients to fly into Albany to get those traveling up from Manhattan to make it a much easier process. We want to be able to work with your OBGYNs, your local REs, local ultrasound and blood drawing stations, so we can make it more accessible, more affordable if you're proceeding with IVF, donor eggs, even IUIs. People will travel because we can make it, I think, a little bit more affordable. But when we integrate that Eastern-Western approach, massage, acupuncture, meditation, prayer, essential oils, check out with our great team on essential oils. And we're really grateful. And I always got to go back to my notes Vicky Mullen and Young Living Essential Oils, always a great shout out. And to Aaron McCullough and our Fertile Hope Yoga. And so I'm always talking about slowing it down, get off the treadmills. Although there was just an article that came out on CNN, I think, and talked about exercise, how great it was. But I'm not sure they properly compared exercise and modified everything else to make sure there was no difference. And so when I tell people not to exercise, I'm not telling you just to be a couch potato. Get up and be creative. Go for a walk in nature. Light bike ride. Get off the treadmill. Paint. Do pottery. Music. Find some creative thing that keeps the mind moving forward. And I had a great vacation, by the way. Last week, T and I went to London, England. Met some great people, took some great tours, went through the museums, and really amazing how easy it is to travel this world and see all the amazing people and places, the art, the architecture. But human beings around the world, we all have the same basic needs. Love, love, love. It's key. All right. Don't forget the CMI Fertility support groups, Lisa Stack, and really all of us need to be sharing the idea of it when we're hurting. And I had a little kind of struggle day yesterday. I was a little busy, some personal things going on, and I was feeling a little bit of down and depressed, and I needed a kind of like something to kick me around and get me moving forward. And I listened to something really good and inspiring. I shared my story with someone, and it made me feel better. And so we all, as humans, get angry and sad and depressed and lash out, or we retract. It's normal. But there are so many resources that we all can utilize, and just let's all tap into all of us in this great village. And again, not just CMI Fertility, but touch base with all your other fertility friends and those suffering and going through these hardships. It is really, really challenging, but let's all keep moving forward and not give up. All right, let's see. Kristen, does transfer line up with ovulation, or can it be done anytime your body is ready? So if we're doing a frozen embryo transfer, we line it up with ovulation, natural cycle, or with the trigger shot, a natural or letrozole clomid cycle, or a medicated cycle where we're adding estrogen and then progesterone. So you need estrogen to thicken the lining and prepare the uterus for that coming egg, sperm, and embryo. And typically about 6 days after progesterone is the timing for a blastocyst embryo. On the 4th day of progesterone for a cleavage stage, day 3 embryo. But this is where the ERA, endometrial biopsy, and receptivity assay comes in, where a biopsy is done in a mock cycle, the cycle before, with whatever you're going to be doing the next month, 2 or 3, for the actual transfer, whether it's natural, letrozole clomid, or injectables, or estrogen, progesterone. That'll tell us the number of hours post-progesterone or ovulation of when to transfer that, plus or minus 2 or 3 hours. So iGenomics, we've been working with them. Finally, New York State has opened it up, but that timing is really important. Lubbock, Texas, how you doing? So many clients from Texas, great docs there, a lot of great opportunities. Traveling is a lot easier than you think, but again, don't give up. Be persistent, and that. All right, with me, this digital process isn't always perfect. I know that the picture may be slightly blurry. I think I'll work on that the next time, but hopefully you can still get the audios there. I hope it's good out there. So Jessica, Tara, celiac, Dora. Celiac disease and Hashimoto's autoimmune disease. I call it inflammatory. Do a frozen embryo transfer soon. What meds for the autoimmune protocol? So keto, keto, keto. Kiltz's keto is strict and narrow. I call it the baby diet: bacon, eggs, butter, beef. Look at Maria Emmerich's stuff, and always a plug for Maria. And check out her keto books. She's prolific. The ideas are great. Really has a lot of really great ideas that I think we should all look at for whatever you're suffering, and it definitely will help. Let's see, prednisone, steroids, baby aspirin, Lovenox, weekly intralipids, keto, 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 low-dose naltrexone, CBD oil, cannabinoid oil. CB Distillery is our primary product. Remember to slow it down. We're looking at Plaquenil or Prograf, a little add-on, the Neupogen, intrauterine with or without subcutaneous, and then things like IVIG, Humira, and LIT therapy are kind of the upper echelon, the next levels. Now, the leukocyte immunotransfusion, either Mexico or Toronto and Markham Fertility, Mike Vero's practice is awesome. They've really been helpful. Our patients before or with pregnancy getting LIT, where the guy's white blood cells are injected under the woman's skin, which helps reduce whatever immunologic process may be attacking. Interesting enough, we're seeing so much on the immune system and cancer and every other disease. My bet and my take on this, inflammation is the foundation, and all the things that we do in medicine are to treat and reduce inflammation. Another is a 2 to 4 week course of antibiotics, and antifungals may be important, but the most important thing is clear the bowels of all the toxic carbohydrates, excessive volume, frequency, amount, and variety. Variety is not good for us, by the way. And we got to get rid of variety, because you can't have boyfriends and girlfriends on the side of your partner. You got to be narrow as an arrow to hit the target straight on. And that's what we're here to share, some really new and awesome ideas. Let's see, Ashley Jenkins, how you doing? Any good information on testing positive for lupus anticoagulant? All right. So remember, lupus is a inflammatory condition, and if you are positive for lupus, Lovenox, heparin, aspirin, steroids. Now you got to be careful about those three together, because there may be a slightly increased risk of gastrointestinal bleeding or osteoporosis if you're using it for any length of time. Most important is work as best you can to reduce whatever you're putting in your body that is likely contributing to that abnormality, by the way. Gluten, carbs, seeds and nuts, coconut oil, believe it or not, maybe one of them. I know my daughter Pilar is allergic to avocados and bananas, but basically most of the carbs are sugar, and fruits, fiber, vegetables is sugar, so it's really, really hard to get away from those. All right, back again. Let's see. I hate meat. Is it okay if I do regular keto? Absolutely. Listen, there's lots of ways to do this. If you're vegan, vegetarian, a standard eater, Mediterranean, paleo, keto. Keto is just another label, by the way. Kiltz's keto is a carnivore diet, and I admit it's not going to be palatable for everyone. It's just another part of the menu. Look at Maria Emmerich's stuff. Look around at Anders Sienfeld, Andrea Davis, and we got a lot of resources on our website. There's so much out there, but basically, if it's a smoothie, a shake, or a powder, throw it away. You want to eat real food, and you want to make sure you're adding real fat. Remember, butter, cream, olive oil, coconut oil, hemp seeds and hemp seed oil. That's fat, by the way. So it's real important that you're really looking to add that fat. And the problem with like chicken and turkey, it's mostly white meat, which is protein, amino acids, which converts basically to sugar in our liver. And so it has harmful properties also. So really work to look out there and do some research yourself, by the way. Hey, Laura from Washington, D.C. We see people from everywhere. And again, full financing programs. We see a lot of people have failed other centers. They've been kicked out of other centers because they might have a low ovarian reserve, they've done poorly, or they just have been told it's not going to work. But persistence, persistence, persistence. You're looking for new ideas and changing attitudes. Keep at it. Don't forget laparoscopy for endometriosis early on. If you're looking to conceive naturally, it helps. Or with assisted reproduction, a laparoscopy will really help reduce inflammation by removing endometriosis or scar tissue. Really, really helps. Jennifer Lampariello, how you doing? Keisha Poller, how you doing? Camping, camping in Indiana for new service dog. Again, a gratitude to everyone. Service dogs are welcome. Your pets are welcome at our facilities, but we try to keep them out of the sensitive areas. So we just want to keep the areas clean and pristine for your egg, sperm, and embryos and whatever you're doing. Hey, Robin Wilson, how you doing? How quickly does AMH levels decrease? Is 1.05 a good number, and 43 years of age? So you can modify AMHs, FSHs, thyroid levels. Everything is modified by what you put in here and what the brain is constantly thinking about. What you put in here, which means what's going on constantly in here, right? So by doing keto, paleo, anti-inflammatory, you're going to really reduce the inflammation in the bowels, which is where the ovaries, tubes, uterus, and testicles, prostate, all live. That inflammation is going to harm the ovaries and the testes and going to harm the AMH. And so we see it improve. AMH up, FSH down. There's really no good way to predict how long your fertility really is going to be. But imagine that you're as fertile as you're going to be, or there's some inflammatory process going on in your body that you can reduce and improve the blood flow in the little microcapillary beds, which affect the ability of oxygen to come in and carbon dioxide to go out. These are factors that affect blood flow tremendously and affect the inflammatory process going on within our bodies. So, hey, Justine Taylor, by the way. Justine's amazing, one of our global practitioners in helping take care of our patients from around the country and around the world. Just really gratitude. Danette Daniels, how you doing? How much will ERA cost? It's about $800 to $1,200. And again, I'm not going to give you an exact number right now because there's the clinical cost of bringing you in, doing an ultrasound, doing the biopsy, and then sending it out, and the cost of the iGenomics. And our job is still to make it the most affordable and accessible for everyone and make it as simple as possible, by the way. It may help about 30% of the cases. It may simply be the endometrial biopsy, and the scratch with the mock cycle may be part of the key to all of this. So it really is interesting that we are being able to do it. It may be something that everyone should do, but like everything isn't always necessary. All right. I've been recently researching Somaderm, which is a homeopathic herbal human growth hormone, pump on the skin, and 1 or 2 a day. Maybe the next step for our priming protocol, by the way, because this is a lot less expensive than the sub-Q HGH, which we still will likely be using for priming and stim, but it may be valuable that we look towards Somaderm or something like this as an herbal, a homeopathic human growth hormone that we're seeing for men and women, by the way, that may be helping egg, sperm, reduce inflammation, but there's a lot on it. Something new and different that we're going to be promoting and talking about in the coming weeks. I've been talking to Joe Davis and some others about this, Joe Franklin, and just really excited to be talking more about it. But again, new stuff, more coming. And again, Albany for IVF, they're awesome and amazing. It's easy to get to. We're really touting our global approach and how we're really working to help everyone find a similar foundation as we're teaching people about cleavage stage embryo transfers. In some cases, not doing pre-genetic testing because it may not be as accurate as we think. But we do offer blastocyst transfers, cleavage. We do fresh or frozen. We do with or without PGS, PGT testing. So it's just different approaches. There isn't one way to do this. We're always looking for your input to this. We work with Dr. Kwok Kim, Dr. Braverman, the Beer Institute, and others. We do a tremendous amount of reproductive immunology. We're familiar with Humira, IVIG, Neupogen, intralipids. We do a lot of, the majority of our foundation is related to immunology and inflammation. How to reduce the inflammation going on in your body to allow fertility to happen naturally, or if it's not happening naturally, to boost it with whatever assisted reproduction we're doing here. And hold on to hope, Courtney Grinfield Fabio. And we want to share hope, have only positive energy. Now, I talked a little bit on one of my Mind, Body, Smile videos today, a little bit about hope is dead, because the word itself is imagining something better tomorrow. The idea today is to have only positive energy, faith and belief in the outcome that you desire as if it is already here. So I don't want anyone to misinterpret my ideas, because I do hold hope every day for all of us on this crazy, challenging journey of infertility. Kelly Neros, the risk of ovarian cancer from IVF medications. Well, 20 plus years ago, over 25 years ago, we were talking about it. It seems to be the diagnosis of infertility may slightly increase your risk of ovarian cancer. My bet is it's inflammation, because that's the leading cause of cancer across the board. Those people who have infertility seem to be the ones that are getting the fertility drugs. So it's not likely the fertility drugs, by the way, it's likely infertility in itself. I believe the biggest challenge today is so many people are suffering from cancer, diabetes, heart disease, inflammation. I bet is excessive amount of food, frequency, variety, and processed. And if you look more and more at Mediterranean, paleo, keto, you'll really find a tremendous amount of helpful advice in this whole process. Increasing the quality of eggs. I have quantity, but the quality by day 5 fails. All right. Murphy Brown, good question. If the quantity is great, but the quality is bad, that's where human growth hormone, either topical, along with LDN, CBD, DHEA, and keto. Again, whatever these little parameters, look towards light therapy, electromagnetic blankets, the Beamer. Another one we didn't bring today, but maybe we're going to bring next time and talk more about it. I could bring my good friend Steve Wexler on to talk about it, but it's all about realigning the energy, reducing inflammation, mostly the inflammation in the gut, which affects the egg, sperm, and embryo. For those that make great day 3s, freeze and or transfer on day 3. Don't take them to blast. There may be some issues going on in the culture conditions that don't allow those embryos to go to blast very well. Sperm issues, DNA fragmentation, that may be another thing to look at and test. But it mostly is the same thing. Remember, men and women, the same problems. Egg and sperm, environment, change the environment, reduce inflammation, slow it down. Cold plunges. Get out of the hot tub, cool the body down. And this is why this cardiovascular exercise is not good. It heats up the core, cooks your DNA, cooks your proteins. It's damaging to our body. I think it's real important to do whatever we can to reduce that inflammation in our bodies. Thanks everyone for sticking with me, the likes and loves. Listen, just watching, you are added into the IVF giveaway. I'm working on an equivalent for whether using donor eggs or whatever you're doing, you're going to get something that's going to be really helpful for everyone. And that's coming up very quickly, by the way. Losing faith and hope, thinking of how we could come up with $25,000. Thank you for making this chance possible. Winnie and Stephanie W. We're all praying for the success for everyone. And remember, the vision is a baby, a family, and building, and the universe conspires in all of our favor to bring it. And if you haven't read The Alchemist by Paulo Coelho, listen to it. Jeremy Irons reads it, or just read it. You got to read more and listen and be inspired by thoughts and ideas. I was watching a great show on the civilization in art. And the artists of the world have created so much. And when you think about it, the scientists that created the technology that allowed us to do this are artists. And this is all about artistry. Looking at some questions, by the way, and really great and inspiring for all the great questions. Hey, Donna Mac, how you doing? Jess Graham, donor eggs, fresh versus frozen. Both. The challenge to synchronize a donor with the retrieval and a fresh transfer is much harder. We're doing so many, you send us the sperm, or we have it frozen and on hand, or bring it in fresh for the day of the egg retrieval, create the embryos and freeze them, and either freeze them on the day 3 or at the blast stage, both work, or thaw eggs, create embryos, and then freeze them and prepare for a fresh transfer that way. That's the way we find that it works the very best. But we do have some that still synchronize and try to use fresh donor eggs, fresh donor transfer. A little bit more difficult, and it's going to add to the cost a little bit because of that process. Quebec, how you doing, Jess? It really is my pleasure, and I'm grateful for everyone out there caring so much about us and this entire amazing village, by the way. Let's see here. And remember, read the comments. We should put this out there, and remember, it's always online for you to go to in the CNY Fertility Facebook. I'm working on creating the Fertile Fireside Chat Facebook side of it, both YouTube, Instagram, and Facebook, so everyone really has access to the whole process. Let's see, Misty, IUI resulted in her 7th loss, including 36 weeks and 18 weeks. I'm so sorry to hear that. Out of options due to finances, and the emotions are humongous. Pray for the miracle, but remember, they come more often than we even realize. And this is, remember, immune throughout the pregnancy. And once you're pregnant, stay keto. Don't change it and get off the treadmill. Exercise in pregnancy, I don't think is good for us. Light walks, more resting. Michigan satellite, we're working on it. Much of it is we want to work with your OBGYNs that they can help bring it together for all of us. And doing that, it really is going to help better and better as we all work in this global village. Let's see, question, Tammy Dupree, 6-day blast. Okay. Embryos tend to become blastocysts day 5, day 6, day 7. They all have potential to become a baby. And so we may be freezing on day 5, 6, or 7. We typically hold through day 7. We haven't found going later than that is helpful. It may be the blasts on day 7 are less likely to implant, but if they implant, they're as likely to become a normal baby as any other embryos that we transfer, by the way. Is ERA recommended after multiple miscarriages or just failed implantation? I don't have that absolute answer, but my bet is at any time, if we could figure out the better implantation environment, timing, this is where, again, immune treatment, antibiotics, hysteroscopy, DNC, laparoscopy for endo, CBD, LDN, and again, maybe back to the Somaderm or the human growth hormone preparation can be very, very, very helpful. And if you have other ideas that you've learned from your docs, Neupogen sub-Q, Prograf or Plaquenil, Humira, Enbrel, IVIG, and LIT. Risk of ovarian cancer, we talked about that. David Williams, how you doing? Really a pleasure. Ashia Haddox, how you doing from Ohio? Somaderm, we're going to be carrying at our CMI fertility locations through our website coming up. And as I mentioned, Joe Franklin through Facebook is going to be posting and talking a lot about it. It's non-prescription, by the way. It's homeopathic, herbal. But, I think that this is where like CBD and essential oil or LDN and keto are all things that you can do. Now, the LDN, by the way, unfortunately is a prescription, but really it's homeopathic doses at the 3 to 4.5 milligram doses, and we can help you with that, by the way. Donor egg IVF. Now, sharing eggs, by the way, is another way to help more women get donor eggs, lower the cost of IVF. One woman is doing the meds, the retrieval, donating half of her eggs to a friend, someone she finds through Facebook, will reduce the cost significantly. There's a little bit of testing that might be covered by insurance, but the more we can help people donate those extra eggs, donate those extra embryos, the more we can help make it more affordable, more accessible around the globe. Been working with Dr. Massey in Atlanta, trying to help also find some egg donors around the world. Dr. Brandeis in Manhattan, working with him for a long time, and Dr. Palta, and going to be talking to Dr. Lisa Eng in Manhattan also. Again, we're here to try to work with your OBGYNs, people have a great contact, or try to make IVF more affordable everywhere. That's really the goal here, because there's so much need. But it's not just IVF, it's all fertility treatments. It's all medical treatments. Medicine should not be so expensive. And our goal is for so many to find faith and Kiltz's keto, bacon, eggs, butter, beef, yes, baby, some form of that. Again, Maria Emmerich, reduce inflammation, and bam, it happens for so many people. Hypertension gone, diabetes gone, high cholesterol out the door. And what most people don't even know, that kale, spinach, and lettuce is sugar. Get rid of it. A good one. Mandy Rastrez. Terzez. How do I force my cycle to start? Well, you can't force it, but change the fuel of the body, slow it down, allow. Remember, it's all about glucose. Glucose causes glycation, inflammation, and all those plant antigens that likely cause all the sinus problems, the inflammation, are really, really hurting all of us. And remember, our bodies require 0 carbohydrates ever to be consumed. And if you look at the food pyramid, it's deadly for all of us. Let's see, I want to continue on that. Whole part of this is how to make it affordable, accessible. After losing my 6-year-old son, oh my God, battling his infertility, winning this. Again, we're all praying for that. We're all winners in the process. Hey, Kimberly from Florida. Ryan, happy Sunday from Cleveland. And on from Quebec. Hello, hello, hello. And the global team, the finance, the billing team, really the support team, the nurses on all locations, global, everyone, really grateful. And be patient with the team. I know we want to throw things and sometimes scream and yell, all of us. I kind of felt that yesterday on my own. But if we can find a way to slow down, positive and patient, it'll help tremendously for all of us. Plaquenil treat lupus anticoagulant issues. So I believe lupus and all the other immune disorders are immunologic. We don't really even know the instigating factors for most of these. So Plaquenil is a great drug to help reduce inflammation. Benadryl, the antihistamine protocol, by the way, let's not forget that one. Claritin, Pepcid, and Benadryl pre-transfer. Oh, and before you get your transfer, don't forget a little acupuncture or massage before IUIs also. And even trigger shot, you're going to have sex. Oh, let's not forget about sex. And so orgasms and be around your partner. These are really important things. But it really is, you gotta get back to the basics. And we're forgetting about that. Set up the stage, the time, and remember, you got to preheat the oven, not just turn a switch on for a microwave like us guys are. Tristan Wilson, PCOS, 3 miscarriages. Would IVF be a good next step to take? IVF really helps everyone, but you don't always not everyone gets fixed with IVF because we're not fixing those other broken things about inflammation. We can fix those. It may help you naturally, but it's also going to help with IVF. So IVF definitely helps even with PCOS and miscarriages. And remember, in PCOS, keto, paleo diets, and I say paleo because paleo helps for a lot. And look around at those recipes. And I stay away from supplements or shakes or fake stuff that help you become keto or paleo. Ain't gonna do it, by the way, in my opinion. Is there Brandon Graham, and I apologize, I'm sometimes getting a little twist and turn as I see some of these questions. PCOS, inositol, by the way, I was gonna mention inositol and metformin for polycystic ovarian syndrome, which is prediabetes and metabolic syndrome. It's all related to the same stuff. Brandon Graham, is there a statistical difference between fresh and frozen versus banked eggs? No, they're really cutting it tight and very similar. And remember, if you get eggs from us and they're duddy eggs, we're going to get you some new eggs. If for some reason they don't fertilize and we're not sure it's a sperm or an egg issue, we're going to work something out to make it a win-win for everyone in this. Lisa McDougall, how you doing? Can keto and CBD oil be enough for someone with advanced endometriosis? It may be enough. I find that again, I believe that the cause of endometriosis is related to the food we put in the bowels. So it's really gut inflammation that's the culprit. Get rid of fruit, fiber, vegetables. Spread your meals out 12, 24 hours. Intermittent feasting, I call it. And both keto and CBD oil are anti-inflammatory. Low-dose naltrexone. And again, back to Somaderm. We're going to be having a link on our website and Facebook to talk much more about it. It may be another anti-inflammatory that's going to help tremendously. We're looking forward to seeing you for transfer on this Thursday. 5 donor eggs. Should I transfer one day 5 and one day 7? You can do that. Might be reasonable to do it on day 6, but we can help time that and make it better. Carolyn, why or how are you able to make IVF so much less expensive than most other clinics in the U.S.? I think the question is the opposite. Why are they so expensive? And I don't know that answer. I was committed to this over 20 years ago. I'm a physician. I'm here to help people find a solution. I make a pretty darn good life, have a good lifestyle, and we're here to help. And whatever we can do to make that happen, my hopes are more people will begin to see that this is possible, and encouraging that, I work hard, but I'm not digging ditches or in a war zone. I think the beauty is that I'm so blessed and lucky to be able to do something I really love. It feels like my pottery art, my painting, it just all feels the same. And your love, your support, and your caring is really helpful out there. And it isn't, we all hear and feel the pain. Some people aren't happy. There's a lot of sadness and anger and fear and worry and regret. This is all normal for all of us to feel and talk more about. Recommending priming with HGH for an FET transfer. I think priming certainly can help. And I know Donna talked about human growth hormone after one of her meetings recently, and really support to Donna and the travel team, Greta. And please forgive me if I'm not mentioning all my team members, but a shout out to the Travel Global team. We're adding some new people on the team. And one other thing I want to talk a little about real quick is that in general, great blastocyst embryos under 35, you get one. Better success rates, less multiples, and less complications from that. And white bottle held up twice so I can look at it. Well, we're gonna post a Somaderm and put it out there, and look at CB Distillery. We're working to get some really good prices. Snake River Farms, by the way, for those that really want some really fantastic grass-fed meat. And we're always looking for resources, and Marie Emmerich's really great for all other keto products, and we're really looking for your input. And please post some of your keto recipes for vegan, vegetarian, all areas, so we can all be helpful, recognizing that we all may approach it a little bit differently, but essentially we want to help do the same thing. Susie Lee, congratulations, success. Priming, again, HGH before frozens, before everything. Again, when I say priming, whatever you're doing, 1 to 3 months of priming to get your body in the healthiest place it can be. Get rid of inflammation, slow it down. Meditation, yoga. Visualize, a vision board. If you don't have pictures of you, babies, and all that stuff all over the place, put them up there. Check out Maria Emmerich's book, I'm sorry, check out Rhonda Byrne's book, The Secret, and check out my book, The Fertile Secret. And I have a new book out called Daily Intentions. It's really about reading something upbeat and inspiring every day to start the day. And throughout the day, pick up a book that's going to inspire you and bring something positive. Listen in your car to something positive. The headphones, listen, because you want to fill the brain and the mouth and the body with inspiring, uplifting thoughts and things. And it doesn't matter your religious beliefs. The foundation of spirituality is about bringing into the body positive vibration, really, really critical. And as a Western trained physician, I've learned how much Eastern ancient traditional practices help. Let's see, lab testing in our Atlanta office. Jessica, really great question. I'm working on it. I talked to Mirabelle this morning, Dr. V, and we're working on it. I got to get some of my team members down there to kind of squeeze it out and shift it around. LabCorp and Quest, but mostly our ability to ship them to Syracuse, run them next day is going to be, I think, a best home run to keep the cost really down. Hey, Kim. How you doing? Happy Sunday. And Kim and her team, really grateful. Let's see, Becca, Britt, Melissa, Larissa, Ashley, Marnie. I just go down the list, and again, grateful, grateful, grateful. Natasha Milas, hello, is 43 too old for an IUI? Well, not at all. Remember, you got to start with where you're at, and everything, each cycle is either 0 or 100, right? And so you got to imagine you're in the 100 category. To at least do something is going to give you the chance of getting something. That's always the important part. Remember, do or do not, there be new try. Master Yoda, never ever give up. Couple from Dubai, London, travel the world. We did laparoscopy, hysteroscopy in our office. We take a look for endo. And so much of what we're talking about, remember, it's a global approach, not a shotgun. That hurts. The blanket approach feels much better in the process. We've almost hit over 200 for the total at any one time. Remember, share this, encourage people to watch it. At any time, we're going to put them in the pot for the winnings. You know, it feels like the $1 billion lottery, I'm sure, for so many. Let's see, Christina, a year of trying with no luck. Do you recommend just fertility meds first before jumping right into IUI? Either natural Clomid or letrozole and or injectables with trigger, intercourse and IUI is going to bump your odds over just intercourse alone. But it's still worthwhile. And so I like to combine intercourse, sex with an IUI. Sometimes we're going to do 2 IUIs back to back. That may be the boost. And don't forget, we're always treating the inflammation, the immune system. Really critical in this whole process. And once you're pregnant, stay keto, by the way. Don't go away. Let's see, IVF in Buffalo, we're working on it. Lab is coming. I'm working on a doc there. But again, monitoring and travel to Syracuse or Albany is so easy. Our ability to keep it tight. We hit 200, by the way. Thanks. And that's, we'll say hi to Kelsey and Sherry and Becky and Sarah. Let's see. So the intention basically of either Clomid, letrozole, or injectables increase the number of follicles by a few. If you have more than 3, the risk of multiples goes up too high. It may be reasonable to convert to IVF. Let's see. Desiree Holman, great. No cheese. Light little cheese. I'm not a big cheese person. Salami. I do a lot of charcuterie. But for those that aren't doing meat at all, be careful about fish. There's a lot of contamination. But you want to add the fat, separate it out, and really cook things down if needed. again, I'm Atlanta. Let's all just visualize and work with Dr. V. We got some other opportunities opening up also, by the way. Lakeisha, Eve, how you doing? Mini IVF thoughts. Well, natural cycle, obviously, if you're just watching natural ovulation triggering and following up with the retrieval, is usually going to get 1 to 2 or 3 eggs. By adding Clomid or letrozole, one form of mini, you're going to get maybe 2 to 5 eggs. And then by adding the letrozole or Clomid with a little bit of injectables, up to 150 units of gonal or follistim or menopur, it's going to maybe get the 4 to 6 range. Success rates are a little less overall compared to standard dosing, which is at about 300 units of gonal F for about 8 to 12 days. And then our high dose is in the 450 to 600. So definitely, if you're looking only for a few eggs, a couple of embryos, 1 or 2, it definitely is a reasonable approach. You're only saving money on the meds. The IVF procedure is going to cost $3,900. And what we work to do is the first 3 cycles, $3,900 each, the 4th cycle, $600, and then it starts over again. Again, encouraging people that it's the more you do, the more you're going to get, the more likely it's going to work. Don't give up, don't give up, don't give up. Keep at it. That's the critical key. And if you're not watching the Today Show already, get watching it, by the way, because CMI Fertility is going to have a segment coming up anywhere in the next 2 to 4 weeks. But really great stuff, and keep watching and learn a lot about it. And I'm moving all around here. Thanks again for the comments, the likes, the sharing. And remember, if you have something to share with us of how someone didn't sound right, we can do better, we want to hear that also, by the way. Pregnitude, I don't have that answer, by the way. I will check on that. Thank you, Sierra. Let's see, Sarah Rumi, and I apologize if I'm pronouncing anyone's names incorrectly. Higher stim doses equal higher follicle numbers. Not always. There's going to be that most people are going to grow, and then for some people they're going to get diminishing returns, and some people only make a few eggs at natural, mini, standard, or high. But you don't know that. Our standard typically is lower AMH, diminished ovarian reserve or function, is go to high dose, 450 to 600 first. Remember, 1 to 3 months of human growth hormone, DHEA, LDN, CBD, keto, and Kiltz's keto is king. And I know it's hard. I practice it now for about 6 or 7 years, and I find it very helpful. Desiree, let's see, Jessica, I want to do my labs and monitoring here and then make the trip IVF in January. We're going to make that happen well before that, by the way. As I said, I talked to Dr. V this morning, and I'm working to hopefully get that in line. Glitches in getting something started, I apologize for that. Let's see here. Milan, laparoscopy tube removed, is tomorrow. Can I start IVF in December for transfer in January? Absolutely. I often will remove the fallopian tubes with the cycle or just before the cycle, so it's all possible. Skyra K. Lee, how you doing? Sierra, really appreciative. Again, remind me about the pregnitude, and let's see. Is it recommended to proceed right away to IVF after failed cycle IUI in October? Yvonne Ebony. You can go right to an IVF cycle whenever you're ready. I've had people do IVF and fail, go to IUI, and it works. So, just because you do one thing doesn't mean you can't back up. It's just, you got to move it around. And you got to do what's comfortable and feels right for you, by the way. So much of what I put out on my website, Facebook, Instagram, YouTube, or just ideas that you could share around. We're looking for so much. What have you done that helped make it work? Let's see. Melissa Stacy, gratitude to your words, thoughts, and ideas. And remember, we're grateful for the successes, and we're praying for future successes. That's where the hope comes in. Let's see. Greg and Kayla Mitchell. Yes, ERA available in Atlanta. Just getting the iGenomics paperwork and all that stuff settled in, so it should be coming rapido. Karina Rubio, let's see. I'm ready to start treatment, but I am having trouble finding a clinic to monitor here in Los Angeles. Go Dodgers, by the way. I used to work at Dodger Stadium when I was 15. I'm born and raised in LA, but we can help you find at least a radiologist, a local LabCorp, maybe your OBGYN can help, but we'll work with the team. If anyone knows of any places that they could get monitoring in Los Angeles, please share it out there for Karina Rubio. We so much appreciate that on this beautiful, beautiful journey of each of us helping extra meds, helping people one way or another. What ideas did you find that worked for you that, even if I fail to mention it, please, let's all share it as a village together. Let's see, Ashley, third transfer, Kensick. My embryos are arrest during development. Anything they should do to ensure actually they can implant? Hysteroscopy, DNC scratch, laparoscopy for endo, the ERA test. Always start with the basics: faith, vision, food, keto, CBD, LDN, HGH helps. Neupogen intrauterine and sub-Q, HCG intrauterine. Look towards Plaquenil, Humira, IVIG, LIT. And I know I say a lot, and hopefully, again, go back to the recording, and you'll get so much more out of that. And don't forget ovarian dysfunction, endometriosis. Those are the diagnoses that really help get coverage. You deserve the diagnostic testing for ovarian dysfunction, polycystic ovarian syndrome, and ovulation. Be your own advocate. You got to fight for it, by the way. You got to fight and talk to your employer that your infertility is a disease like diabetes, hypertension, cancer, stroke, and everything. We want to encourage New York State and every other state and locale, but go to your employers. But certainly at CMI Fertility, we offer payment plans that you can get 4 IVF cycles and finance them, all of them, for at least 3 years. And we're working on up to 5 years at a $40 finance, $40 management fee per month. That makes it much more affordable and accessible for so many people. Kai Ryan, Renee, chemical pregnancies, there are a risk of infection. I'm a week without meds and still no period. Slight risk, but if it's a chemical pregnancy, make sure you stop your meds. A biochemical pregnancy, we call it. It could be a tubal pregnancy also, so make sure you're getting your weekly checks. It may be worth an antibiotic, and it may be worth either methotrexate and or a hysteroscopy DNC to clear things out. It feels like we're getting there, 8:59. Again, pleasure for always joining in and sharing. We're so grateful to the shares, the love, the likes. The critiquing and criticism is important for me, so I can help discuss with our team ways of doing it differently, making it better. The frozen transfer, so the freezing, so good question here about cost, Raquel Rodriguez. The the retrieval and the IVF lab, the freezing and a fresh transfer is included in the $3,900. The frozen transfers are $250 plus monitoring and any meds. We do have a package pricing for all of that, and we're also working on a package pricing for PGT, for PGS, PGD testing, biopsies, to make it much more affordable and easier. And we're working with Integrity, with other pharmacies to get the very best pricing. So whatever you can do, help us. Hey, where'd you find the best pricing for your fertility meds? Sherry, please send me a message via Messenger. Okay, great. Everyone's chatting back and forth, continuing. I can talk for another 5 hours. Again, so grateful. I try my darndest to take care of all the texts, emails, and calls. Sometimes at the end of the evening, I've got to put it away to get rest and relaxation, to be vibrant and ready to help the next day and the next morning. So if for any reason I'm not getting back to you right away, there's the portal, web correspondence. But if you're really not getting someone, you got me, all right? Don't hesitate. No age limit, by the way, no weight limit, no failed limits of previous cycles. We're here to help you. God bless. I think I've hit most of my major points here. Oh, platelet-rich plasma. Currently with Dr. V in Atlanta. We're going to be working on it in New York. Intrauterine, maybe intraovarian. We do a lot of male fertility, and we want to make sure the guys are getting the same screening as the gals and evaluation. God bless to all. Thank you for sharing. And remember, share the likes and loves, and we'll see you next Sunday. God bless.